Okay, hi everyone. Welcome back to episode 6 of ChatRx. Today I'm here with Dr. Christina Fontana, and today we're going to be talking about growing your brand as a student and mental well-being. She is also known as the Pharmacist Coach. So, Dr. Christina Fontana, would you like to introduce yourself?
Absolutely. So I want to just actually acknowledge you before I say anything about myself because um I love the ability to connect with so many different people all over the world, pharmacists, healers, everybody that I meet. And it's really what stood out from, kind of everybody on social media. I don't even know how we got connected, probably through Todd Uri or something like that.
Yeah.
But I love how you guys are really kind of challenging the status quo and starting to already think outside the box, even in pharmacy school. And before we started recording this, you were talking about, really having this platform to provide uplifting content. And I love that so much. So I want to just take a moment and
Oh,
acknowledge
thank you.
you for everything that you're doing, because it just shows how progressive you are in wanting to serve, even though you're doing residency applications and going through pharmacy school. So but yeah, I'm just so honored to be here with you for episode 6. Yay,
Yes,
let's
very
celebrate that.
excited. Thank you for the kudos. I appreciate it.
Yeah, absolutely.
Appreciate it.
So for those of you who are new to hearing from me, about me, my name is Dr. Christina Fontana. So I graduated from St. John's University in 2012 and went on to do a residency, community pharmacy residency at King's Pharmacy in Brooklyn. So I'm originally from Long Island. You'll hear my my voice, my
I
accent
was
coming out
wondering
through my
where it was
voice.
from.
Yeah, yeah. And so oh geez, I could probably sit here all day and tell you the long story of pharmacy school, residency, and all of the things that came after that. But I essentially, what I do now is I help empower women to release blocks that are holding them back so that they can shine in who they really are. So that's one subset of people that I work with, related to releasing self-sabotage, overcoming self-destructive patterns, because I have been through that myself. I went through, 2 different eating disorders, anxiety, PTSD, a lot of, my early trauma and childhood experiences led me to doing the work that I do today. So that's one subset of people that I work with. And then what I love is working with healers in healthcare, pharmacists, nurses, doctors, to help them become more trauma informed and to show up and shine in who they are and the gifts that God gave them so that they can scale profitable, world changing businesses. So that's really the work that I do in the world now. And this is 11 years of being an entrepreneur. So I didn't start here. I actually started this journey, and I'm very transparent about this whole journey. Homeless and broke and having literally nothing, living out of my car 2 months before pharmacy school. My parents kicked me out of the house because my dad owned a pharmacy and he wanted me to take over that pharmacy. And something in me knew that I was meant to do something different, that I had to pave my own way. And they didn't get it. So there was a lot of that control, a lot of fear from my parents, like I was betraying them.
Mhm.
And so that's really where my journey started, was going through the residency process, never having had a job other than, working for my dad. So I had to figure out like how to make business cards and how to create a CV and all of those things, while dealing with an active eating disorder, living in a house where I had to walk on eggshells because my parents literally hated me, and, going through pharmacy school and all of these things. So I I say that because it's so easy to look at someone and be like, oh my God, like your website's so great and da 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 da. And you're so put together, but I'm not. That's the funny thing, is like I am always growing and evolving. And I think that's really the point of life, right? To be open, to change, to grow. And so I'm always learning. Like right now I'm going through I'm joining this National Speakers Association, and because I want to grow and stretch myself. And So I start by telling you this story because no matter what you're going through in life, whether, whoever's listening to this, if you're a pharmacy student, pharmacist, if you're a non-pharmacist, that's, we welcome that too. We go through different things in life that strengthen our character, because I can tell you, I would not be who I am today without that experience, without coming to Pittsburgh and having a broken engagement and having so many other, I call them, actually, I know I'm not allowed to curse on here, but blank storms in my life that I know led me to embody the person I am today, and I'm continually growing. So that's kind of my intro.
Oh, I'm inspired, and we haven't even, touched the ropes with this episode yet. I mean, everything you mentioned, I think a lot of people can relate to in one way or another. Whether it's big events that they've gone through or just the daily life struggles adding up. So thank you for sharing your story. I hope it touches home with a lot of people that they're not alone in what they are going through. So I'm excited to get started with the content.
Yeah.
As always, we have to start with a cartoon character that is going to give us life advice. So have you thought about which one you're going to choose?
Oh my God, a cartoon character.
Yes.
I was
It
just
doesn't
watching,
always work out. Sometimes we really have to,
yeah,
integrate what it means, but
yeah, I don't even know, man. I'm thinking of like, so I love Christmas movies, and I'm just thinking
okay.
of like some of these. So like I guess this is a cartoon, like those old stop motion, it was Rankin Bass. They had these Christmas movies back in like the 60s and 70s, and they had that Rudolph the Red-Nosed Reindeer movie. Like that's me. I
Oh,
am
I
like,
know okay, I know which one you're talking about. I'm probably gonna have to
yes,
like look
with
into
like
it, but
Hermie the elf. Come on, those of you guys who know, exactly what I'm talking
oh,
about.
I love it.
I would probably be like the misfit toy or something like that, because
Uh,
and I own that. I'm kind of like the black sheep of my family, and but I own it now. I know that was, I'm here to do things differently. So I would say probably one of those characters like Rudolph,
okay.
or like, I don't have a red nose. I have a red cheek right now because I have my rosacea flare, but that's okay.
I love it. All right, I'm gonna have to find one of the best ones. Might be Rodolph just because of the season. I mean, we are going into the holidays, so I feel like that's
Yeah.
festive. You're festive. We'll just do something festive. So,
Yeah.
all right. Well, you already told us a little bit about you, kind of your background. But can you explain to listeners maybe what holistic healing is and the rapid transformation coaching, and
Yeah.
really how they coincide or differ from the traditional pharmacy world?
Oh, absolutely. So when we're in pharmacy school, a lot of what we learn is, about suppressing symptoms, essentially. Conventional medicine is looking at, okay, you have a symptom. What drug, what medicine, what thing do we have to do to suppress that symptom? Whether it's an immune response or, suppressing whatever that might be that's causing inflammation, whatever that is. And so we look at, I don't know, this is what we looked at 11 years ago when I was in pharmacy school. They talk a little bit about lifestyle modifications and nutrition, and, what is the root cause of illness. And as I was going through my own eating disorder, I started to awaken and start asking these questions about, like, why do I have this? None of these things make sense. Okay, oh, it's genetics, right? Oh, it's this, it's that. And what I learned in pharmacy school wasn't lining up with what I was experiencing. And so that led me down this path of looking at all of these non-traditional ways of healing myself. And so, there's conventional medicine, then there's things like herbalism and functional medicine that, you're still ingesting something outside of yourself to regulate hormones or whatever that might be that's out of balance, because that's what healing is, right? Healing is coming back into wholeness, coming back into balance. But then there's another layer. There's that deeper layer, and this is where I go when I'm looking at clients and assessing them. It's self-healing. So it's looking at trauma, how the effects of trauma are, trauma lives in the body. And so I started looking at the nervous system and how when we experience a trauma, we go into fight, flight, freeze, and everybody responds differently to trauma. And a trauma is essentially where a situation where you felt powerless, where there was a feeling of inescapability, and it was a shock to you. So it doesn't have to be a major traumatic event. It could be something where you felt like your voice wasn't being heard and at work or something like that, and it really shook you. And the body keeps that cellular memory. So what happens is we go into these responses and we wonder why we have anxiety, right? Because whenever we go to fight, the fight, flight, freeze, when you go into that fight, that's when you're in sympathetic mode, right? That dominant sympathetic mode. And you have conditions like anxiety, agitation, and not depression, and like irritability. If somebody goes to more shutdown and freeze, then they're going to be experiencing, think about shutting down like a computer, depressive symptoms, kind of like spacing out, not being, dissociating. And so everybody has these different responses that are coming through, and healthcare does not assess that. We don't look at the root cause of disease. And so, yes, it's about nutrition and lifestyle and all of these other factors. But what I found over my research over the last 11 years is if a person is disempowered, you can tell them till you're blue in the face, take this vitamin, do this thing. But if they have these different mechanisms that are running through them, and they have unworthiness because of some past experience that they had, they're going to be disempowered because they're holding on to maybe shame or guilt or fear that's causing them to not love themselves enough to want to be healthy. So it's very layered, the work that I do. And like I said, I'm a huge nerd. I've researched so much about disease and the nervous system and hypnosis, the subconscious mind. And these are the things that I want pharmacists to know. These are the tools that I want to empower pharmacists and other healers in healthcare to know, that these, motivational interviewing, as an example, that is a huge asset to be able to use with your patients to help them with behavior change. Because really that's what it all comes back to, that root cause of disease. Epigenetics shows 5% of disease is from genes, right? We can't change that. We can change the 95% of what we do every day, which is our lifestyle choices, our mindset, our, what we're feeding ourselves and putting into our body. And I can tell you, when I had my eating disorder, I did not like myself, right? Because I had so much trauma. And so I was binge drinking, I was binge eating, I didn't like who I was. And as a result, those lifestyle choices I was making were not healthy. So we need to change from the inside out. That's essentially what it's coming down to, is not just looking at suppressing symptoms, not just looking at what pill can I take to regulate this. As corny as it sounds, it's coming back to loving ourselves and remembering who we are. Yeah. So that's what healing is to me.
I love this train of thought, because I myself have found myself so frustrated leaving a doctor's appointment and being like, okay, cool, they prescribed me, maybe it's an antibiotic, antivirals, whatever it is, and being like, okay, but like, what if it comes back? Or like, what if I continue getting sick? And like, I asked them, okay, why am I getting sick 8 times this year? And I get so frustrated that I always feel like the root cause is not addressed. And I know so many family members and friends who are on the same page. And it's one thing to, as pharmacists too, to give a patient medication, but if they are on that level, to really be able to accept that behavior change of how to take it and understand how it's going to help, and understand, I love this term, showing up for yourself. That's, one thing that's really kept me going. We're never going to see results in our patients. We're never going to see results in ourselves. So I love this, loving yourself, showing up for yourself, that whole motto. And I think the fact that you've stepped out of the traditional healthcare role as a pharmacist and really taken a holistic approach to it is inspiring. And I hope that as we move forward as practitioners, not only me, but my friends and everybody else in pharmacy school, that we take a step back and take that holistic approach to just giving people medication. It's not just that. A lot of times there is a root cause like trauma that you mentioned that needs to be addressed first, because medication may mask it or it may even make it worse. And I think a lot of times that's kind of swept under the rug in healthcare. So let me ask you something. I don't know if I want to quite go down a rabbit hole with this, but do you
Yeah.
think that healthcare and big business being tied so much and all of the money behind it is influencing practitioners' decision making more than really the drive to want to help people? Do you think there's a disconnect in what they're being told to do versus what's actually going to heal the patient?
Yeah. I mean, I know that
Sense.
doctors, I know with even in pharmacy school, we get like one class on nutrition, it's not really a focus, but I think there are definitely incentives all throughout the healthcare system for people to not get better, essentially, right? So I don't know how that trickles down into the treatment guidelines or things like that. But even as an example, with the old food pyramid, there are incentives for dairy farmers to have oh, you need 3 servings of dairy a day. Like I remember learning that in integrative nutrition, the health coaching school I went through. So I think that there are definitely incentives for different people. I don't know the exact logistics of what that looks like, but I know that we can't control that. What I can control, just even with the pharmacist walkouts or whatever, good for pharmacists for standing up. And, I'm starting to see little changes in the chain pharmacies too, where they're giving pharmacists a break. I never had breaks when I was, a full-time pharmacist. And so I think it's up to us as practitioners to, again, be empowered to make those choices. How do I want to practice at the top scope of my license? And for me, this is the most fulfilling avenue that I have found. I'm not going to dispense medication. I'm not going to be in a hospital or a long-term care facility. That's just not in my DNA. And everybody's different. Some people love research. Some people like AmCare or whatever it is. I think the PharmD is such a great starting point. And I knew that right when I got out of pharmacy school. I'm like, 6 figures. I know everybody's like, oh, I have a doctorate. That's the starting point for me. I'm like, okay, how can I serve? What can I do? I've written books, held retreats, done all these different things, because to me, that is the most fulfilling way that I can serve using my gifts. So I think even for all the students listening out there, if you can feel good about the choices that you're making and how you're serving using your specific gifts, then that is true fulfillment. So, the healthcare system is tricky. I know
it's tricky. And I think a lot of us go into healthcare for the basic, we want to help people. And I think that as you add layers of education, sometimes that starts to trickle down, because a lot of guidelines, whatever it may be, there's always influencing factors. And I think staying true to wanting to help is always a good thing to have in your back pocket of, okay, why am I really at work today? Whatever it may be. But all right. So you wrote that book that you mentioned, you're an author, and you wrote the book Reignite Your Light, Simple and Effective Burnout Prevention Strategies. Can you share some fundamentals of that book that you think maybe students could benefit from? Speaking about being a light and burnout and the walkouts.
Exactly. Well, we kind of went over some of it already with just even the nervous system work, because the polyvagal theory, I've studied a lot of that by Dr. Stephen Porges, and he talks about this ladder, right? So it's kind of what I talked about before, where, when your body senses a threat, the top of that ladder is the fight or flight. So that's where you feel some anxiety. There's a threat from the environment, whether it's, it doesn't have to be a lion or a bear chasing you. It could be hey, whatever's happening right now feels familiar from a past trauma or a past event, and it triggers you. Then if things keep happening in your external environment where you're feeling like there's so many things coming at you, typically what happens is you go down that ladder into freeze, it's called. Freeze is a blended state of essentially sympathetic and parasympathetic, where you're literally frozen because there's so much happening. There's a lot of overwhelm, a lot of overthinking, perfectionism. A lot of pharmacists live here that I found because I coach so many of them. And this is where you start to kind of go more into that shutdown. And then the very bottom of the ladder is dorsal vagal, where this is where you're just completely shut down. So there's severe procrastination. You feel like you can't get out of bed. You can fall into, feeling really low with your mood. And it's because your body is trying to protect itself. At all costs, your body is trying to stay safe. And so oftentimes the nervous system reflects the state of our immune system. So if you're getting sick a lot, like you were saying before, that is a sign that, I don't know if you've heard of HRV, heart rate variability. That is an actual measurement and a piece of bio data that you can use to measure the state and the health of your nervous system. So if it's low, then that means that your body is more so in that sympathetic dominance. You're more likely to get sick because you're run down. So your body can't bounce back. It's not as resilient. Whereas if the HRV is high, that means that you're more in that relaxed state. And so doing some of these nervous system exercises, and I'll actually do one here with you, can help to kind of bring your body back into safety, because ultimately that's what your body's wanting, to get back to that homeostasis. So one thing that you can do is you can just literally put your tongue to the roof of your mouth. So I'll do it with you here. So everybody listening,
Okay.
I can't talk and do this at the same time, but what you're going to do, we're activating the vagus nerve, which everybody should know, 10th cranial nerve. And we're going to just put your tongue to the roof of your mouth for about 7 to 10 seconds. So let's just do that now. And you might yawn. You can let it go now. You might yawn. You might feel a deepening in your breath.
Definitely a deeper breath. I feel that.
Yep. So that's your body responding. And so that's just one simple thing that I teach in that. It's an ebook. Actually, if you go onto my link tree in my Instagram, you can get it for free. It's my sixth book technically. But it's an ebook that just has these 13 different strategies of how to help reduce burnout, because it's so prevalent. And of course, burnout comes from many different places. It's not that, we're blaming ourselves like, oh, I can't cope. But again, we can't control what's happening in our workplace all the time, right? So I am always the type of person, I'm like, okay, I can't control what's out there. What can I control about what's happening in here? And so this is it. That's why I created that resource to, number one, educate, but also to empower you to know, all right, this is really tough. I'm nervous about this exam. If you're in pharmacy school, whatever that might be, or I have to walk into this interview and I'm like, I know what that feels like. Do the tongue exercise, because no one's going to know.
That's
right?
true. Yeah, no, I mean, nobody's going to know if your tongue's on the top of the top of your mouth and your mouth's closed. So
yeah. So
I mean, that's a good one. It's not like you're sitting there meditating in the middle of the interview floor. So.
Another one is the ear, like, you're kind of pulling on your ear gently. So if you're watching a video of this, you can, I'll just show you really quickly, but you're just, again, everything is connected through this. This is a social engagement center, but this is where you can activate the vagus nerve too. Obviously, this is going to be a little bit more obvious rather than the tongue one, but you can do that and just kind of then moving to the top of your ear and just gently. And I already feel a deepening in my breath from that. So
this might be like a
Yeah.
really good thing to do before a test, like you were saying, or before an
Yes.
interview or something stressful on a daily basis. Now, we kind of talked about burnout. Now, burnout as a student is interesting because you don't really have a choice, like what you want to do and what you don't want to do. So you also talked about control and only focusing on really yourself and not letting those things that you can't control influence you that much. How do you think, as a student, sometimes we could help ourselves as far as not going down that rabbit hole of burnout and worrying about a bunch of things that we can't control?
Yeah, I think that one of the things that's coming to my mind is students I know and high achievers, myself included, we put so much pressure on ourselves.
Mhm.
So sometimes that stress is very much internal.
Yep.
So that's why this nervous system work can help because again, it's a tuning with yourself because we're so busy. We're like, oh, I have to the test and oh, I have to study this. But how often do we actually sit with ourselves and say, hey, honey, how are you feeling today? And actually pause and take that moment to do one of these exercises or
Mhm.
be with ourselves. Because when we don't stop and do that, that's when we go down that polyvagal ladder. Like I said, the dorsal vagal that's burnout at the
Yeah.
bottom. So there are signs that are happening, in your body, in your mind that are saying, hey, this is too much. And so even something as simple than to support your nervous system, and again, this is all in that document, that ebook, eating regular, like balancing your blood sugar, eating regular meals with protein, hydrating, that's, making sure you're drinking plenty of water, self-care, setting boundaries, all of those things affect that HRV score I was talking about before. So you do have control over those things, and you absolutely can work towards being more in tune with yourself. Like I know, as an example, really simple example, I used to just push through lunch and I'm like, you know what? I have to work.
That's me. That's
Yep.
me. Mhm.
And I don't do that. I'm like, oh no. Mm-mm. Like this can wait. This email's going to wait. I have to, especially being pregnant. I'm like, I'm nourishing this baby right.
Right, right.
I'm 23 weeks pregnant right now. And so like making those micro decisions. Okay, how do I feel right now? Do I need water? Do I need a walk? Another way to regulate your nervous system is changing position. So if you've been sitting all day, get up and move around, go take a quick walk outside, change, scenery. That actually helps you get out of freeze. If you're finding yourself like overthinking, go for like a quick walk. Like
Yeah.
all these things that we tell patients to do, it's actually regulating
Yeah.
your nervous system.
Yeah. No,
Like that's
pharmacists
really
are
what it is.
definitely the worst patients when it comes to like telling their patients to do something and then not doing
Mhm.
it themselves. I mean, that's me.
Yep.
But
Yeah.
yeah, no, I mean that's a good point of I feel like sometimes in the past, like we would go on hour-long study sessions, and I think just getting up, maybe moving to a different study room, a different chair, something like that could have
Right.
helped just reset.
Yep.
Um,
And
that's good advice.
this is like a really funny like tie-in because I'm pregnant, so I'm going to
Uh-huh.
these baby classes or whatever because I don't know what I'm doing, and they're like, okay, well, okay, if your baby's crying, go take them for a walk, take them outside, change. I'm like, oh my God, I know this stuff. I'm like, okay.
Right.
So it's similar to, because babies are so sensitive. So it's the same thing. Are they fed? Do they need to go change environment? So this all starts very early on, and it's about taking care of yourself and making sure that you're setting yourself up um to not get to that burnout spot. You know what I mean? So
Yeah.
I thought
Yeah.
that
And
was kind of cool.
that is really cool. And I think a lot of times we get so caught up in the competition of, whether it be getting into pharmacy school or then pursuing a
Yep.
residency or getting a job that sometimes we think that we don't have time for that. And I think one thing that I've learned over the years is that the time that I've lost worrying is equal, if not more, to the time that it would have been to just take those 30 seconds to a minute and be like, how are you doing? Or showing up for myself, like what you talked about, and doing those emotional regulation check-ins and those physical check-ins of, okay, am I fed? Am I what? Am I water?
Look
Like
at
I'm a
me.
plant or something. But it's real. Like I think if
Yeah.
I would have taken the time to just do that, whether it be an alarm to just step away from the computer, go get something to drink, go get something to eat, I really would have saved time in the end, because
Yeah.
the alternative is just sitting there twiddling my thumbs because I'm burned out on whatever it is.
Yeah. Yeah. Well,
That's a
you're
good
not
point.
alone. You're not alone because like I said, I am still, there's a reason why I do this work because there are different levels and layers of it. And like I have a nervous system coach that's always helping me because entrepreneurship is really going to dysregulate your nervous system because, we're so used to getting, okay, like I worked really hard. I got an A on this paper. Oh, I'm captain of the soccer team. I get this award. We're so used to that. I work hard. This happens in entrepreneurship. It ain't
Not
like
that.
that.
It's not that.
It's
Yep.
like,
Because
it's
there's nobody there being like, great job, besides
yeah,
yourself.
sometimes
Yeah.
and I'm like, thank you when,
Right.
but
Yeah.
it takes a lot of inner resilience. I've learned that over the years, and you will be met with, if anybody's out there interested in entrepreneurship, I'm happy to be a sounding board or be of service and help in any way I can. But you are going to face off with these patterns, right? People pleasing, perfectionism, overthinking, because all of that comes out when you're selling your services, when you have to go speak in front of an audience, whatever that is. And so this nervous system work helps to really ground you back into safety within yourself because we're so used to getting that paycheck, and money equals
Yep.
safety to the ego. So it's like, how do I create that inner sense of safety so that I'm not relying on other people's validation, clients, all that other stuff that like it's normal. It's the human experience. So I've had to really work with myself, with my own trauma and these different responses, because I have all of them too. People pleasing, perfectionism,
Mhm.
so but that's a whole other probably podcast episode.
I know. Maybe we'll do it on that too.
Entrepreneurship, yeah.
I know. Well, I was going to ask real quick because you also wrote elevating into entrepreneurship, right?
Yeah, yeah, that,
Um, so for students looking to delve into entrepreneurial, non-traditional pharmacy endeavors, what advice would you have? I know it's probably going to be broad because this could also be another podcast,
yeah, no,
but
and you know what? I think that's a really great question because this book actually highlights 19 different people, non-traditional pharmacists that are doing everything from someone does financial coaching and she, is an accountant now. Somebody else, people do like herbalism, consulting or functional medicine, pharmacogenomics. I mean, like I said, the PharmD is really like
it
there's so
is.
much you can do
Yeah.
with it. So that's what I love about this book is that you can look and see, oh my God, like I didn't realize that you could do blah blah blah. Like there are 19 different stories in this book from people just really thinking outside the box, and that's what I love
Mhm.
about this one. But what I would say is really that be open to, like, you're listening to this podcast for a reason.
Yeah.
If you meet a mentor, if you read a book, follow what is exciting to you. Like there's probably a reason why you're doing AmCare, right? So
Yeah.
that's
I
the
mean,
advice.
I've also thought about functional medicine. Like, I'm happy you mentioned that. Or stuff similar to what you do, because I think I've really liked taking that holistic approach as a practitioner in career fields like EM care or functional medicine within pharmacy, where you get to do that on a daily basis. I think it's something I would like to do.
Oh, absolutely.
Yeah. All right. So you have, first of all, I'm going to have you send me that book and I will share it with all of the listeners. And
Yeah.
maybe I'll even do like a podcast on some of those individual ones. But you have some inspiring testimonials from clients you've worked with on a personal and a professional level. Your website has, testimonies from people who really got over some roadblocks within their career and personally. So how would you recommend students stay focused on their personal and professional goals if they hit a roadblock as they develop in the workforce?
So this is where I don't know, my spirituality is going to come through, and I'm not going to apologize for it. So
No, don't.
so
Don't.
God is my CEO, and that to me is true safety. Like
Mhm.
I guess because I've gone through addiction, like food addiction and codependency and all these different things. What I've learned in my journey, and you could ask, somebody the same question, they would say something different, but what keeps me grounded is my faith, because
Mhm.
I have had so many times in my life, like I said, I was homeless, I had eating disorders, and I would wake up every night and binge on really unhealthy food. I was out of control. I had no control of it. It was like this, I don't know, it was like this vicious cycle that I was caught in. Then I had, I was engaged to somebody. I was attracting narcissistic men. There were all of these just very vicious cycles that every time, like, I would look to God and say, okay, like, lead me to somebody who can help me, lead me to, like, just show me the breadcrumb trail and I'll be led to it. And so for me, my faith is what keeps me grounded and anchored, because I can't control what someone says about me, what a client does or doesn't do, but I can control myself, and I can surrender and lean on my faith of, like, God is my CEO. God is going to direct
Mhm.
my steps. Yes, I take action, but it's co-creation. So I think that's how I view it. Like, we can't control everything. And worrying is a form of wanting to control,
Yes.
because it's like, oh well, if I worry about it, if I fixate on it, like, maybe I can avoid pain in some way, which I get too. I understand that. So it's that's kind of it's a really deep answer, but for me, that's what's kept me grounded all through all of the storms in my life.
Yeah. Well, I appreciate you being so open and honest about, where you've been, what's changed you, what's helped you, and just really being transparent, because these transparent conversations are going to help some listener. I mean, they've helped me already. Like, I'm inspired, and I really hear what you're saying, and I relate to it on many different levels. And I feel like that control keeps coming up in conversation, so I want to talk about that a little bit. I think as students, especially high achieving people, which pharmacists usually are, we love to be in control. I love to be in control, and I think that's a detriment to us sometimes. Um, how would you recommend letting go of things that we can't control? Because that's always way easier said than done.
Yeah.
Do you
Yeah.
have any techniques or things
Yes,
that have helped you or clients?
absolutely. I literally before have gotten down on my hands and knees on my little, like, rug over here, and I just let it all go. So whatever surrender means to you, whether it's like just laying in corpse pose, in yoga, or meditating and doing a guided meditation, or even walking outside. Like, I love to walk. It's crisp. The air is really crisp here in
Mm-hmm.
Pennsylvania right now. And I love taking sunset walks. I think it's just so nourishing for me. So you have to kind of find what gets you to that place, because
Mm-hmm.
trust me, I get it. And that's what eating disorders are rooted in: control. So I'm like,
Mm-hmm.
I hear you with that. And, a lot of anxiety comes with that too. But physically, how does somebody surrender, right? Like the corpse pose, or sometimes I'll just, like I said, just kind of bow and be like, and I talk to God, and I'm like,
Mm-hmm.
I give this to you, because then that's where the pressure comes in, right? We put so much pressure on ourselves. And really, I was going to mention this before. I'm glad this came up again in my mind. There's my job, and then there's not my job. So my job, even like in my business, and apply this to you, whoever's listening, my job is to show up and serve using my God-given gifts, setting healthy boundaries, taking care of my nervous system, my baby. I cannot control what someone else does. I cannot control, um, what emotions, my actions create in someone else, or maybe someone watches a video and they get triggered. I can't control that. And so I think even writing that out, I just posted about this too on Instagram. it kind of like helps you see where do you have control and where do you not have control, because you can't control everything. And so I think it's like those rituals, whatever works for you physically. And maybe it's just like shaking out your body and like, opening up. That's another nervous system exercise, is like literally just shaking your body out. Like this. I know it looks a little bit crazy.
Yeah.
But it helps mobilize that freeze energy. So like if you're in freeze, shaking your hands and legs for 30 seconds can really help mobilize some of that energy rather than being like this. So like a physical practice, but then also maybe even writing down, like I said, what is my job here? What is not my job? And then letting go of the rest. There's also that serenity prayer. I know it's like, God grant me you know what I'm talking about.
Yeah, I do. Right? I do. I've also heard this analogy that I really liked. I can't remember where I got it. It may have been like a TikTok, who knows? But it was like, imagine everything you're stressed about right now, and then imagine blowing it into a balloon. So there's that physical aspect of like physically blowing it into this imaginary balloon and then taking a hold of it and then releasing it and just imagining this big wide open sky and it's just floating up there. And I've done that before, and I feel like that helps kind of release some of that anxiety, that negative energy, because you have that physical aspect to disperse some of it, like what we were talking about. So
absolutely,
that's a good strategy also. All right, so I do want to discuss, last thing, kind of growing your brand. This has been big for me lately, as well as a lot of other people applying to residencies and fellowship. Growing your brand as a pharmacist, who do you want to be? What are your goals? That kind of thing. So you have done this in creating, the Pharmacist Coach. So what really is a brand as a professional, and how can we begin to grow it as students, whether, the student listener is a P1 or a P4 or a resident? What is the key?
So your brand is essentially your essence. That's the way I see it. Sorry, Penny, stop. Come over here. Here, I'm going to show you my dog real quick.
I love it. We love dogs on the show. Vinny has yet to make an appearance, but maybe he will.
Scratching. She was here the whole time, but now he's being bad.
So cute. Okay. Hello, Penny.
So she's a little wiener dog, who's trying to scratch at the. I didn't want her to distract us. So essentially, your brand to me is your essence. It's shining in your gifts and what is true to you. So your brand comes through in your messaging and your self-expression. And, I'm specifically thinking of entrepreneurship too. In your programs and your offerings, it all comes from within. And I always use this example because I love this diamond. I love this. So this diamond represents our true essence and how we came onto this earth. We came with God-given gifts. We came with brilliant, filled with light, this energy that we can use in our business, in, pharmacy school, to be of service to humanity. That's why we're all here, right? But what happens is we start to say, oh, I'm not good enough. Oh, I had this happen to me, so therefore I'm a bad person. Da, 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 da. And before you know it, it's like you can't even see the diamond anymore. So doing this inner work and releasing and all of the things that I'm talking about with transformation is helping to uncover this diamond so that you can shine authentically in your message, in your brand. And so that's actually part of my brand. So if you look even behind me,
I know, I was going to mention that. You talk about shining and all that.
That is why I'm here. I am here because I have dimmed my light for so long, from shame around being highly sensitive and being different and non-traditional and all of those things, and kind of breaking out of the box. But I own that now because I've integrated those lessons. But everything that I have, it's all about light shining in your gifts. And so that's my brand. You can clearly, like, if somebody saw something, and anybody in my audience, and they were like, oh, and there was nothing on the image, but it was just like something like that, right? Where it had like sparkle or glitter, or like, again, it's here. I love it. They're going to be like, oh, that's Christina, right? So it's kind of like you owning who you are and it comes across in so many different ways.
Yeah.
So find what is unique to you, even as a student, and let that shine in your interview, in, whatever that is. I know, what is mid-year? Where is it this year?
Anaheim.
Oh, okay. Yeah.
Anaheim, yes. So I will be there, obviously.
Yep.
And I'm thinking about everything like I've been taught and told over the years with becoming a professional of how do you want to come off, like make sure you do this. Your CV has to look like this.
Right.
You want to come off like this. And I think really at the end of the day, like obviously you want to be a professional, but the more that you can let those talents show and who you are at the core show, I think that's going to set you apart a lot more
Yep.
than any way that you try to sound in an interview, because that's going to
Right.
be inauthentic at the end of the
Yep.
day. And that's going to dim, your light of how you could really shine if you accept that that's who you are and
Right.
let those attributes come to light. Anyway, but
I know, I love that so much. You totally get it. And a lot of the beginning part of, I call it like awakening to who you really
mhm,
are, is releasing. Like you said, we have been programmed from so early on. Oh, sit down, look pretty, don't speak too loud. Little girls are, quiet, they better seen, not heard.
mhm,
Like all of that, it doesn't allow for you to express who you really are. So a lot of the first steps are releasing and revealing your true gifts and what it is that you have to share. And it sounds like that, part of you already knows that. So yeah, but it is, it's there's a lot of pressure, with the white coat and like looking a certain way. I like, no, I'm not making offense to our profession at all. I'm like, I am done with the white coat. I'm never wearing a white coat again. Burn it. Like, I'm not
yeah,
wearing it. Like, that's just me though. Like, everybody has, do what you want to do, but it just didn't feel aligned to me anymore, because it felt like more stifling
mhm,
than self-expressive. So I
mhm,
just say, go with what feels good for you, and the right people are going to be attracted to that light, to that diamond, right?
mhm.
And it's going to resonate. And for some people it won't, but you have to really be strong in yourself to own those gifts and what you have. So
Completely agree. And I think part of building your brand too as a professional and a student is embracing that you are an individual and that individuality, and that you are going to be different from others, and that that's totally okay. And I think that the more that we can accept that, the more we let our light shine and we really get to see what we can become, versus if we're always trying to fit ourselves into this little box of your CV has to look like this, you have to do XYZ in order to get a residency, you have to do ABCDE appies at X institution, you're not really allowing yourself to explore opportunities where your talents could really shine. So we talked about this on
absolutely.
our last podcast, but there's no right way to do anything. Um, and if you kind of just let that guard down and let yourself shine, like what you're talking about, I think maybe as students we'll see some happier students. Um,
Yeah.
anyway. All right, last thing. I could talk and talk all day to you. This has been great. If you had to choose a specific student-oriented problem-solving technique, so this could be like something for students to do when they're stressed for a test, which we kind of talked about, or something students could do when looking for a job, or something students could do um, to commit things to memory more, to share with listeners, what would it be and why?
Mm, I would say, just like I'm being, my intuition's bringing me back to kind of that check-in with self,
Hmm.
because your body is so wise that it knows if something is a yes or if something's like, that doesn't resonate. So don't force yourself into places or spaces that aren't aligned with that light, with who you are. So this kind of goes with like transparency and authenticity. If you're showing up to this interview, as an example, for mid-year, and you're like, yeah, I really love da 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 da, but like you really don't, like show up and say, hey, I'm really interested in this, and speak that, and own that. I think that that's going to allow that other residency director to say, oh, she's a perfect fit. And if it's not a failure. I actually, my top 5 picks, I didn't get any of them with the match. I actually had to go through the scramble. I'm like, okay, like, don't make it mean anything about yourself. Like, oh my God, I suck, or I'm bad, or whatever. It's just not in alignment. And maybe it's protecting you. So seeing kind of like the bigger picture of like things are happening for you. There's a reason why things are happening, and also connecting back to what is true to me, what feels good for me, because we don't do that. We're like, oh, what is that person doing? What's that person doing? And so that's, when in those quiet spaces, you can hear your intuition. I think that's the best compass for anybody.
I love it. Well, thank you so much for being here today, and
Oh, I
congrats on your
loved it.
baby. I'm so excited
Yeah.
for you. And I think this episode is going to be really beneficial to listeners. I mean, the things that we've talked about, I think a lot of people don't talk about enough. So just the fact that you were here today and we're going to be putting this out there for people to derive benefit from, I think is really special. And you really are such a light, and so keep doing what you're doing. I've
Thank you.
been very inspired. I was able to find a quote from the movies that you were talking about, and I chose one from Donner, and he said, oh my gosh, of course I lost it on my screen. Oh no.
Any of those quotes would be good. You could always put it in the show.
Oh, here it is. Okay. He said, well, I thought that it was very fitting for our conversation today. He said, there are more important things than comfort, self-respect. So, we talked about trauma and kind of falling into habits that really might not be as good for us. And then we also talked about showing up for yourself and letting your light shine. So thank you, Donner, for your life quote, that there are more important things than comfort. So listeners, I hope that all of you recognize the importance of self-respect, and letting your light shine, and like you said, staying true to your faith, because that is huge as well. So
Yeah.
thank you again
so
for
much.
being here today, and I'm happy that you DM'd me on Instagram and that we were able to get this episode out. So
absolutely, my pleasure.
all right, episode 6. Thank you.